Pressure is building against Dayton-area State Senator Steve Huffman, whose public comments this week about minorities and COVID-19 continue to draw criticism here and across the country. Mark Namick explains the latest fallout and efforts to push him out of office.
During a hearing Tuesday to discuss racism as a public health crisis, Dayton-area Republican Steve Huffman questioned why African Americans are being hit harder by the coronavirus.
Could it just be that African Americans or the colored population do not wash their hands as well as other groups?
The language, long considered racist with roots in segregation, quickly condemned. Yesterday, Huffman fired from his job as an ER doctor. His employer saying, quote, Dr. Huffman's comments are wholly inconsistent with our values and a commitment to creating a tolerant and diverse workplace. Huffman has apologized, saying he awkwardly phrased his question. But the Ohio Legislative Black Caucus, the ACLU of Ohio, and others continue today to call for his resignation from public office.
The reason that we have the health disparities within the African American community is specifically due to racism here in America. For it to come from a medical doctor professionally, it really highlights what we have in this system.
Studies show minorities have a disproportionately high number of COVID cases because they suffer from more underlying health issues due to their lack of access to health care. Dr. Charles Modlin, director of the Cleveland Clinic's Minority Men's Health Center, says the pandemic is exposing racial disparities.
Now we have to use this crisis as an opportunity to educate the rest of America, to educate policymakers, governmental officials, elected officials.
State lawmakers haven't yet passed a resolution declaring racism a public health crisis. And while House would like to see Huffman step down, she told me today she'd rather have him as a partner to help promote cultural and bias sensitivity training to the General Assembly. Mark Namick, 3 News.